Hi, this is Dr. Abdul Ahad Khan, orthopedic surgeon from CarePoint Medical Center, Ras Al Khaimah. Today I'll speak on vitamin D. Majority of us speak that this is a vitamin. Actually, it is not a vitamin. It is a hormone, T hormone, which is synthesized in the skin. It is a very, very important molecule in the body. Vitamin D works through vitamin D receptors, which are present in almost all the cells. Most of the studies show that more than 400 different kinds of tissue types show vitamin D. The most important one is brain, hypothalamus, heart, immune system, which is the most important system. Our immune system works on the basis that how much vitamin D is available in the body. Majority of immune cells, they have receptors, whether it is an innate immunity or it is an adaptive immunity. Both of them, they depends on the availability of vitamin D in the body. It's very important. Most of us, we know the role of vitamin D only in calcium homeostasis, which is a little role. The bigger role is in the immunity. It is an immunomodulator. It is something anti-inflammatory. Majority of the immunity system is present in the gut, intestinal mucosa. These cells, they have vitamin D receptors. How it operates? It operates through gut microbiome. Any kind of intervention in the gut microbiome or gut dysbiosis will create problems for vitamin D and its functions, which are directly related with the brain, heart, immunity to fight against infections. Why globally there's an epidemic of vitamin D deficiency? What are the reasons? Reasons are probably number one, these receptors, vitamin D receptors, they become invalid by organisms like bacteria, virus, fungi. They make them dysfunctional. There are certain mutations in vitamin D receptors which make them dysfunctional. These are the important issues that we are supposed to know about vitamin D, why there's a global deficiency and why there's an emphasis. Most of the research, emerging research, is proving the role of vitamin D in a plethora of different kinds of illnesses, like autoimmune diseases, like neurodegenerative disorders, like rheumatological illnesses. Today, there is a big confusion regarding the level of vitamin D. It is either in nanogram or in nanomole, but less than 20 nanogram is deficient, less than 30 is insufficient, and optimal level means it should be between 50 to 90. The toxicity is again a very controversial phenomenon. We do not have any research paper or any kind of a support from science to decide. There are some researchers who are speaking that until 200 nanogram, there's no toxicity. And there are certain diseases like autoimmune diseases, you need high doses of vitamin D. There's a fear unnecessarily for vitamin D toxicity. We do not see much of the research on this controversial issue. And recently, rather, we have seen uh, different kinds of papers which are supporting high dose of vitamins for prolonged period of time in patients like multiple sclerosis, in patients like Alzheimer's, and it is proving to be very, very good. Patients are responding positively. So these are very important issues regarding vitamin D. Vitamin D is created in our skin by sunlight. Vitamin D you can have from the diet if you get organic fishes, not farm raised. Vitamin D you can have from supplementations. I have seen a lot of patients who are working in the sunlight and their vitamin level is zero, and probably the reason is that they are having some kinds of hidden infections in the body. They are having maybe some kinds of mutation in the receptors of vitamin D. So these issues are to be taken very seriously and to be investigated. Vitamin D has entirely a different approach now. Now we are looking into diseases in a different way in the light of vitamin D. Each and every, I'm not saying that you can treat Alzheimer's or multiple sclerosis. These are really crippling diseases. But certainly, if you give heavy doses of vitamin D, it is going to change the outcome. So this is about vitamin D. Thank you so much for listening.